The proper care for your dental bridge is vital in ensuring its long-term durability as well as its effectiveness. The dental bridge is the most common method to replace missing teeth. However, regular treatment is vital to prevent damages or problems. In this short video, we'll go over the actions you should take to ensure the longevity and beauty of your dental bridge. 1. Regularly flossing and brushing. The most crucial elements of taking care of your bridge dental is keeping the best dental hygiene. Similar to natural teeth, bridges can collect plaque, food particles, and even food debris that can cause gum infection. It is important to wash your teeth at least 2 times each day. You should also floss every single day with particular focus on those areas surrounding the bridge in which plaque may rapidly develop. 2. Clean the bridge with the bridge cleaner. As well as regular cleaning and flossing routinely, it's suggested to employ a specific bridge cleaner to help keep your dental bridge free of plaque. They are specifically designed to get into and clean places that are difficult to reach around the bridge. They also prevent plaque buildup while maintaining the structural integrity of the bridge. 3. Do not eat hard or sticky food items. To avoid damages to your dental bridge and prevent damage to it, be careful not to bite into the hard, sticky food. Certain types of food may put a lot of pressure upon the bridge, damaging it and causing it to crack or break loose. It is better to choose more pliable foods, then break smaller pieces of them to lessen the stress over the bridge. 4. Visit your dentist regularly. Every 6 months, regular visits to your dentist are vital for the safety and security of your dental bridge. Your dentist will be able to monitor the health of your bridge and perform any needed adjustments or repairs to stop any issues developing. Furthermore, professional cleaning can assist in the removal of any hard-to-remove tartar and plaque which may be hard to get rid of at the home. 5. Do not smoke or drink excessively. Consumption. Drinking alcohol and smoking cigarettes may have negative effects on the health of your mouth and the lifespan of your dental bridge. The tobacco-related products can discolor your teeth and bridge in addition to increasing the likelihood of suffering from gum disease, as well as other dental health issues. The consumption of alcohol can cause dry mouth and gum disease that can compromise the strength of your dental bridge. When you stay clear of these bad habits and avoiding alcohol, you will be able to maintain your appearance and the health of your bridge over the years to follow. 6. You could think about having a night watch. If you have the effects of bruxism or grinding your teeth, it's important to shield your dental bridge from deterioration. Continuous grinding and clenching may put too much pressure on the bridge, leading to fractures and cracks as time passes. The use of a night guard will keep your bridge safe while you rest, delaying destruction and prolonging its life. The bottom line is that taking good care of your bridge dental is crucial to preserve its function and look. Through maintaining a healthy oral health by avoiding bad habits and seeing your dentist frequently and regularly, you will make sure that the bridge you have chosen to use and enjoy your healthy smile for a long time to follow. Be aware that prevention is essential for dentistry, so you must take those necessary steps to properly take care of your dental bridge and maintain the health of your mouth.